And can we have the same insurance Congress has as the public hospital? That's what the health insurance store would be. Let me tell you, just so you understand, let me tell you, please, what federal employees have. This is 8 million current and former federal employees, including members of Congress and employees of the Department of Defense and the Department of Agriculture, in the FEHB, as it's known, the Federal Employees Health Benefits Plan. There are some plans that we can choose from. Most of them choose Blue Cross. They pay this is members of Congress or employees of the Defense Department. They pay a monthly premium. They are subject to the conditions and coverage of that plan. And that employer-based insurance is similar to what employees of Caterpillar and Johnson & Johnson and Bank of America have. That's what federal employees have, including members of Congress. Now, if there's a change of employment, somebody leaves the Department of Defense, they would be eligible to go to the insurance store just like anybody else who is not covered. So it really is very much what this insurance store is an array of plans that you can choose from that are much like the FEHB that all federal employees have. I will tell you, I am a principal original sponsor of a public single-payer health care. Now, for a public option, should there be in the insurance store, should there be one option, one of the many options there, a plan that is run by the government, I would say the advantages of doing that are it would exert downward pressure on cost, because you don't need to pay the CEO. Just compare the salary of the head of Aetna to the salary of the Secretary of Health and Human Services, for starters. Secondly, it will exert downward pressure by having a large pool of people in the insurance pool. And as I mentioned earlier, I think if this were available in the companies in the insurance store, that it would provide a way to inject into the healthcare system more quickly best practice, the highest standard of what areas of government spending do you think can be cut to help pay for healthcare reform? One of the things that I have signed on to, the leadership of the House has also publicly committed, that any additional cost of the healthcare reform, and there might be none, but any additional cost that there is, any additional cost will be paid for. In other words, it is subject to what we call pay-as-you-go scheme. Okay, so what that means is probably, yes, if you earn more than $350,000 a year,
your own president has $250,000. You're $350,000. You guys don't know what you're talking about.
What is in there now, as it is taking shape, I said this is not written in indelible ink, but as it is now taking shape, Americans with an income over $350,000 will pay a tax surcharge on the amount over $350,000. So it's not as if, and that would be
Why succeed? You're better off being a failure.
a principal way of paying for it. There also, as I said, would be savings in Medicare, because as it is now, there are a lot of redundant tests. It is efficient. Medicare has an overhead of several percent. Since fear of massive lawsuits caused doctors to order more tests than might be necessary, will you vote for a plan that does not include tort reform? I might well vote for a plan that does or does not include tort reform. Let me tell you about tort reform. Let me tell you about tort reform.
Yes or no? Yes or no?
Yes or no question?
It's a yes or no. Say yes or no.
Yes or no?
So let me tell you about tort reform. I expect that in the succeeding negotiations on this legislation, there will be some more in there about tort reform. There is already in the bill tort reform.
No, there's not.
Here's what it is.
What is it?
You got to remember that tort liability law is a state matter. Any lawyers in the room? That's where you go for your lawsuits for medical malpractice. It is a state court matter. Some states have already imposed tort reform, liability law reform. This legislation would include money for additional states to develop tort reform in those states, and it would help pay for the study.
Where does it say that?
It doesn't say it.
It does say that. That's actually Bart Gordon's amendment. Bart Gordon's amendment that was passed in the Energy and Commerce Committee. It's Bart Gordon's amendment that was passed in the Energy and Commerce Committee, which is the last action that the House has taken on this legislation. So there is some attention to tort reform in this bill. I wouldn't be surprised if there's more. Don't hold your breath for that bringing down costs in healthcare. Take all of the non-compensatory judgments in all of the states around the country. Compared to the cost of healthcare, it is minuscule.
$10 billion.
Now,
$10 billion.
the next important question is, does the threat of lawsuit change the practice of medicine? Is there a lot of defensive medicine because of it? Doctors tell me that most of the tests that are ordered because they don't want to make a mistake. It's not because they don't want to be sued. It's because... Furthermore, and here's the clincher. Here is the clincher. In Texas, where they had massive tort reform, caps on judgments and so forth, a number of parts to that legislation, costs have not gone down. And the practice of defensive medicine, which is harder to measure, probably has not decreased.